Hello, friends, and welcome back to another episode of the Concussion Nerds podcast. And we are joined with Dr. Rachel.
Hello,
again
hello.
today. As you've noticed, there is no set schedule on Dr. Rachel joins us. It's more like when we look on our calendars and go, let's record.
It's a little unpredictable. So,
Keeps you all on your toes, but you
Yeah.
get to look forward to. Today, we're going to be diving into how we build confidence for clinicians working with persistent concussion, because this is a huge thing that we come up with over and over again. And I've been treating persistent concussion now for almost 10 years. And actually, I just thought this. I love that you're here for this one because Dr. Rachel's been treating persistent concussion for how long?
like 2-3 years. But in the last kind of 6 months, it's dramatically increased.
Yeah. So this
Yeah.
is really great because I sometimes forget that what I do isn't the norm.
Yeah, for sure.
And so I forget sometimes, and I don't mean to, obviously, I forget the path people sometimes travel and some of the challenges that happen. So in this episode, we're going to be talking a bit about the different ways and what we look at when we want to increase our confidence in persistent concussion specifically. Timeout, side note, if you are a clinician listening to this and you are looking to kind of take that first step in that confidence, my foundational Rethink Rehab 4-hour workshop runs live every month. And this month it is on April 30th. So it's on Wednesday instead of a Friday this month from 9 a.m. to 1 p.m. Pacific time. And so link is in the show notes. Feel free to come check it out. You have lifetime access to the recording. Obviously, it's a live teaching, so you can ask me questions and meet some other amazing clinicians who are in the same position as you, who are truly wanting to increase their confidence in working with persistent concussion and leading in this space. So that is coming up on April 30th. But let's dive into this first. So when we say someone lacks confidence, what are some of those things and those feelings for you that used to show up in like your day-to-day when you were working through a client? Like, how did that actually show up in your practice?
I feel like for me, especially before I came to Symphony, and concussion is 90% of what we treat, right? So at Symphony, you are surrounded by a lot of people who are treating the same type of things, a similar mindset that you can go to ask questions, which has been amazing. And I think prior to that, for me, the lacking confidence side of it came more so from if I saw a new symptom or things weren't quite lining up black and white, it was like, who the heck do I ask for this, right? And it was at my old clinic, I was kind of the only person treating vestib and concussion. And so it was, okay, let's try to reach out to people online or try to read some research, etc. But it was hard unless you have those people around you and you have a community, whether that's in your clinic, whether that's like an online concussion type of program to kind of bounce ideas off of, right? Because concussion is complex. You do something different for every patient. And yeah, sometimes it's really necessary to talk things through with other people.
Yeah. I think when I created Nerds, that was a big piece of it, right?
For sure.
So this is your first time ever listening to this podcast. Concussion Nerds is my 6-month clinical mentorship program that Dr. Rachel has gone through. That was a big piece of when I was building that program. It was like me stepping back to be like, what didn't I have that I'd wished I'd had? And the mentorship and the community was a huge piece of it. But I think even before then, like there's these times where you guys, like you're moving along tickety boo and like you're having great success with your client. You know, we just wrapped up, we've taught 3 different Rethink Rehab workshops now. I just finished teaching a workshop with Neuro 360. We have nerds coming into the program all the time. And the resounding thing is like, you're doing great until that person shows up in front of you that makes you question everything you know.
For sure.
Right. And then the next person shows up in front of you and continues to make you question. And then there's those days where you literally like sit in the office. And I said, because this is, I do this still. But you sit in the office and you're looking at your assessment sheet and you're like, fuck.
Where do I start?
Yeah. It's like, do I know anything? And that feeling, if you're a therapist listening to that, when you feel that, like you need to know that every single one of us feel that more than once.
For sure.
In our career. And I think it brings up this point that you were saying before we even started recording, was that regardless of where we are in this business, and I say when I like mentor too, and you've heard me say it many times, like I just have a lot more reps. I have a lot more reps and I've done a fuck ton of training. I swear Rachel laughs every time because that's just me. Like I've done hours of training, like in my own knowledge, but oh my gosh.
But yeah, it happens to everyone, right?
But we're always learning.
Yes, 100%.
And you said it in the beginning, like when working with complex concussions, we have to remember to stay humble.
For sure.
So do you want to elaborate on that a little bit? Because that's one of the first things you said when we talked about talking about this talk.
For sure. I think that especially when you're coming out of school, right? Some people have an idea of what they want to specialize in. You go into school thinking, or I went into school thinking, oh, I want to treat concussion. Like, this is great.
I did.
Yeah, well, different paths. And it's easy, like, to be in the mindset where, okay, I'm going to get through school and then I'm going to start my own practice or do all these things. And that's great. But I think it goes back to you have to be humble enough to know that a lot of the knowledge you're going to gain, the reps you're going to get, all of this, it comes after school. And so as much as you learn in school, I think, honestly, for me, a majority of the stuff that I utilize in practice every day comes from the courses I've taken outside of it. It comes from all of the clinicians I've shadowed. It comes from the conversations, etc. And I think if you want to be someone that is in the concussion space or treating these complex patients, you have to be humble enough to seek out the education and ask for help when you need it, because we all need it.
Yeah. And, I think we need to recognize too that those of us that are in the field that are educating, we are all, even my mentors, like we are all still learning.
Yeah.
We all still recognize that there's no way we know everything. And I've spoken with clinicians who have, and if this is you listening to this, like just as a general person, like who reached out to me about nerds. And then when we talk about the fact that we do the multi-systems, I get an answer like, well, I've done the vestibular certification, so I'm fine for the vestibular system. That is a closed mindset of someone not willing to learn more. Yeah. And I can guarantee you, if you're listening to this, whether you've done the vestibular certification in the gold standard world of physio, you're still going to learn more about the vestibular system.
There's always more to learn about the vestibular system.
And so I love that of being humble and recognizing that we always do want to be learning. This field is changing so fast, just in terms of the brain, not even in understanding those implications. And I'm going to take it a step further to being that humble to recognize and to be able to be vulnerable enough to admit when you don't know something and know that you are no longer the person, like you don't have the answers, because then at the point when you don't have the answers and you've also run out of theories, you have, I'm going to say 3 options, and then you can disagree with me or change my mind. But option 1 would be connect with mentors or a community who can support you in continuing to support that client. And that's what I love about Symphony so much, and the nerds, is that we will bounce things off each other all the time. Or you can refer out to somebody, right? So that referral network is so important. Refer out to somebody or discharge the client off your caseload without telling them that this is as good as they're going to get, please.
Yeah.
It's just because we've reached our ceiling doesn't mean the client has reached their ceiling. And that's a really important piece. So
yeah, for sure. And I think that last point is important, right? Because you don't want to keep kind of guesswork with a patient and keep trying things if they're not getting better. But I think the most important thing is you either have to know where to refer them or be humble enough to be like, I don't know what else to do for you. This is not the end of the road for you. However, there's somebody else out there that might be a better fit.
And the respect that client is going to have for you if you do that, whether you know someone to refer them to or not.
Yeah.
Like, they're so much been like continuously trying to treat somebody, when I always say, like, you just feel like you're throwing spaghetti at the wall and hope something sticks, right? So we did an episode in mini school, and one of the key things we talked about is that our clients have the right to ask us what our treatment plan, right? The clients, we encouraged them in this call because let's also be real, their lives have been turned upside down and they want to understand what is happening in their brain and their body as well, so they can live their life as best as they can in this process of healing. So I encourage them, and we encourage them to say, if they don't have a clue if they're going to therapy regularly, but they don't actually have a clue what is being worked on or what the goals are, to ask you as the therapist and say, hey, I was just wondering if we could like reiterate for me what we found in my assessment that we are working on and what the plan is. As a therapist listening to this, we need to be able and we should know what that treatment plan is. And so with the complex client, what can happen is that we don't necessarily know what we're doing. And so you just start picking random things and trying them. And then if that random thing flares the client or makes the client symptomatic, then that becomes part of the treatment. And then you like grab something else and then that becomes part of the treatment. If that's you, then I'm encouraging you to pause with this with all your complex clients and like take a step back for a second and just be like, for yourself, what is the treatment plan here? Right? So if you are feeling overwhelmed by somebody, because this is the hard part too, is with a complex client, it is always because there's multiple factors involved. There is multiple systems involved and multiple factors involved. It's not one thing. And so sometimes I would say the challenge, Rach, is that not only from a systems perspective is where do I start? How do I order this? How do I structure it? How can I choose one exercise to address 3 things instead of 5 exercises to address each thing? We know that's true.
Yeah.
And then is it the right time? Like, is there so many other factors going on that this doesn't feel like the right time for my intervention because I have the capacity to do it? But then how do we have that conversation with the client who so badly wants the rehab?
Yeah.
Right? I'd say those tend to be the 2 big themes when people are struggling with persistent is not knowing where to begin and how to build everything. And then also when there's so many other life factors involved, and we've had this discussion in clinic, how do you help that person prioritize what needs to be done and step away, potentially actually pause our rehab component?
Yeah, for sure. And I think the communication part between the clinician and the patient is the most important thing. And I think I agree 100% with what you were saying before about not being afraid as a patient to ask why. But I think I would also put it on the clinician to try their best to explain and make sure that you're doing a good job in that aspect. Because from a patient's perspective, sometimes you just don't know how to ask. And you feel like you don't know if you can ask, what you should be asking, et cetera. And that's hard, right? And I feel like as a clinician, I think it's important to try your best to be like, even if you don't know exactly why you're doing it, you're like, hey, this is the findings, this is my plan, and this is why. Are you okay if we try this? Yeah. Are you okay if we go down this path together? And making sure that they understand why you're doing what you're doing and what kind of your thought process is there. Because sometimes we kind of just get wrapped up in it and we want to go and try. And I think unless you have that trust and that communication with your patient, I think it makes it harder to get those results.
This huge point. Like, so this came up when you shadowed a day with an intensive client of mine.
Yes.
So I'm very much that therapist that post a session, I can explain why I tried everything I tried. But in that moment, sometimes when I'm trying to figure something out, I know why I'm pulling the tools I'm pulling, but I don't have the capacity in that exact moment to also explain in a teaching moment why I'm doing it. And so this came to light. So Dr. Rachel and another concussion nerd were shadowing me with a client that I had for an intensive. And this client had the craziest saccadic intrusions I have actually seen in someone in quite a while, of which she's still doing great. She's crushing it.
Nice.
And for this person, it was in her left smooth pursuit, and she would be okay until like 30 degrees. And then the first saccadic intrusion, and then it was like that for the rest of the attempted smooth pursuit. I say attempted because it did not look like a smooth pursuit. And so I know that when I'm working on a saccadic intrusion, there's certain pieces I want to pull into play versus if I'm looking at a catch-up saccade. I also know how if I want to build out a peripheral field. And so literally, I have Dr. Rachel standing there and I have this nerd shadowing. Dr. Rachel knows how I roll, so I don't have to say anything to her. The client also knows how I roll. So I turn to the other concussion nerd and I'm like, I'm just going to try some things. I'll explain it at the end when I find what's going to actually give us that click. And I did. It was like, and then I pulled Doctor's play. I was like, I need you to hold this while I do this. And I put this hemi field, this hemi stim here, but we got it.
Yeah.
And then once we got it, I could be like, okay, here's why I tried this. Then here's why I layered this piece on. And here's why I added this piece. We had to pull in a lot of shit to get this smooth pursuit to actually look like a smooth pursuit and to not have these intrusions. But the beautiful thing is, like what you said too, is this client has her utmost trust in us.
Yeah. And like, because of that trust, and she knew what was wrong.
Yeah.
She could feel it. She could tell. She was like, that is what I've been dealing with, but I can tell that's not right. And then you come into the play and you're like, well, let me try these things. And we're working on it. We're trying different things and it worked, right? And at the end of that, it's okay, now let me take a step back and explain to you a little bit more maybe of what I did, or explain to whoever else is in the room a little bit more of why I did what I did. But that's a great example of, you don't always know if the things that you're going to do are going to work, but you know why you're trying them.
Yeah. That's a beautiful example of that, actually. And that's the piece the clients want. It's like, we knew exactly what we were addressing. We knew why we were addressing it. She gave me some freedom, and like, I was like, here's some things I'm going to try. Roll with me. Success. Yay. Thank God. The success. And then I could go back and explain to everyone the process I took to get there. But that process became, you also, I think this is a good point too. As a therapist, you need to understand how you think and you process as well, right? So in those moments when I'm really having to like work those connections in my brain, I don't vocalize things anymore, which if you normally work with me, that's weird because I vocalize everything except when I'm really thinking. And so if you're someone that does that as well, communicate that to your person, right? So with those people, and like when anyone shadows, or if the client's in front of me, I will say that, like, roll with me here for a minute. Like, I need to work through this in my head. We'll talk about it after, so that they know I'm not just like shutting people out and like don't know what the fuck I'm doing. But that is how like I internalize and I go quiet as I try things out, and then we'll talk about it at the end. But again, like you said, it was like, we understood why we were doing it. We understood what we were working on. We understood why we were working on it. And we had a plethora of avenues to attempt to track it. And then at the end of the success, we communicated. So I think that speaks to as well, if you're a therapist here and you're struggling, like that's step number one, right? This is why we just like go back and forth and talk. It's like, there we go. If you are struggling with a persistent client, take a breath first, like pause, take a step back, and then let's look at, what am I working on? If you're already stuck on question one of what am I working on, then I mean, that's where you start, right? Yeah. So then the question is, why don't you know?
Yeah. Let's figure that out.
What you're working on.
Yeah. If you're just taking shots in the dark without having a reason why you're doing it, like, why are you doing it?
Yeah.
And I think it all comes back to number one, right?
Yeah. And then that question is, if you can't figure out why you don't know what you're working on, then let's take the client completely out of the equation for a second. Let's hold a mirror up and let's ask ourselves some hard questions. Do we need to expand our own learning? And is this an area that you truly want to expand your learning in? Right? Like, persistent concussion is not for the faint of heart, because every person is a puzzle, and the positive impacts you have on someone's life are insane. And you get to build some really amazing relationships with people on this journey. But that's that first question, is if you've pulled back on a client and you're like, what am I working on? And you're like, I don't know. Remove the client from the equation and look at yourself in the mirror. Why don't you know? Is it that there's too much going on? Is it that you've been able to do an assessment, but there's all these pieces and you're like, there's just so much happening, I don't know where to start? Is it that you actually don't know what to assess to figure out what's happening? So then honestly, with both of those, it's okay, well, you need more training.
For sure.
I don't know how else to phrase it. Right?
Yeah.
So then say you're like, okay, I know what is happening. I know what I'm working on. I know why I'm working on it. Sweet. Great.
Good job.
But I'm stuck and we're not making any changes. So here's a beautiful example. Honestly, like, all these answers are going to be like, I have a network, get some more training. But anyways, here's another example. So we have a new concussion nerd. Okay. They joined after our Neuro 360 course, and I shared their win on Instagram because I was super stoked. So this person knew what they were working on. They were having huge otolithic. They had a client with significant otolithic issues. They'd been working on them for quite some time. When they first started working, they had a subjective visual vertical of 7. Poor client.
Not good.
So they knew what they were working on. They knew why they were working on it. They knew the importance of that system. But they had been struggling with the how. The like, what do I do to treat? That person came into Nerds and posted a win after they'd been in there for like 2 weeks saying like, Odalith win! Like I'd been working with this person for quite some time. We were super stuck since joining Nerds and the other course that I co-facilitated, like, and implementing what we teach in that program. Like their subjective visual vertical has improved from 7 to 2, like symptoms have gone down. And I was like cheering this person on.
That's amazing.
Right.
Yeah.
And now the other big thing is they have community, right? So if you're that person that you're like, okay, I know what's happening. I know why I'm doing it, but I'm stuck on the why. This is where either, I would say, when we talked earlier about either deepening your own skill set or having a community or colleagues that you can reach out to like pick brain or refer out.
100%.
Right?
Yeah.
Like those are kind of the
options
to continue to learn.
Yeah.
It's hard to, in a podcast episode, to be like, how do you get more confident? Well, you get more confident when that person that rolls into your clinic and sits in front of you and shares their story and you do their findings and you look at it and you're like, I got this. Like, it's because you know what to do with what they're telling you. It's because you know what to do with the information you get from that assessment confidently. It's because you have a process to move through so you know what's relevant, what's less relevant, and like the order to attack it, for lack of a better word. And then that confidence soars even more when your clients start celebrating their wins and sharing their wins and seeing their changes.
Which is pretty great.
Right?
Especially in this space, right, where most of our clients have seen multiple people before, and that's cool to be a piece of their story and their success. But yeah, I think that for sure is a huge driver of confidence, right?
I know she's going to be listening to this episode because she listens to every episode. Rach has this client who is like, this woman is amazing. She should be a coach at some point because her way to see other people, and I know she's listening to this, so, and you know who you are, but her way to see other people and to articulate what she sees is pretty powerful. But she will literally send Rachel an email after every mini?
Yes.
Okay. After every mini intensive with the wins, with the changes she's seeing in a positive way in her life since the latest work that her and Rachel have done together. As a therapist, like we can't tell you enough like how powerful that is for us to keep going.
Oh, 100%. And especially with clients that are on that more mini intensive type of schedule with us, like there's a whole month where we don't see them. And so just to have those little tidbits of all of the wins someone's having, or even on other days when it's like, hey, this kind of popped up and this might be a struggle, like it's great to continue to have that communication, and it just shows their trust in your opinions and your thoughts, etc. But yeah, she's amazing, and she definitely has a great ability to kind of reflect and articulate and share those. So
yeah. And so for the clinicians too, right? When you start hearing those wins, that dominoes into, or like wheels back into your confidence getting higher because you knew what to do with that person and they have the wins, they have the outcomes. And when you do that with someone else, they get the wins and your confidence just starts to build.
100%.
So yeah, I don't really think I have much else to say today.
I think with that summed it up pretty good. I think it's that balance of the increase in confidence, but still kind of knowing and being aware that there's still going to be those days where a patient walks in your door and you're not too sure what to do, and that's okay, right?
Absolutely.
So
it's going to continue to happen to all of us in some capacity.
Yeah.
Like it never goes away.
No.
So it's why so many of us continue to educate ourselves, and in different ways as well.
For sure.
Right? Like I think it'll be really interesting to see in the concussion world over the next few years how it continues to evolve, how people continue to niche their own practices, how I think we're at the beginning of an evolution.
Yeah.
And I'm really excited to see how it transforms, in saying that we need clinicians who are not willing to settle for the status quo and to recognize that we can all be doing better and should all be doing better, because unfortunately the stories we hear are still so prevalent.
Yeah.
Anyways, that's my like little side tangent. Anything else to say today, Dr. Rachel?
I think that is all good.
Okay. To everyone listening, thank you so much for being here. We'll be back next week. I have no idea what the topic is, but that's pretty normal. So have a lovely day. And again, if you are listening to this and you are that clinician who is ready to up-level your confidence, there is multitudes of ways to work with me to help you in that process. And it would be my honor. Jump into my Instagram, send me a DM, and let's connect. Wishing you a wonderful day. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.